leg, calf, mobilization techniques and strategies, transformational zone 1. We have an inverted position with the wedge, and in the single leg toe touchdown staggered stance foot position, we're going to be using a rocker step. And in this inverted position, we're going to be feeding in to the lateral hip and lateral foot and ankle complex. We're further putting in the frontal plane the driver into an inverted position in terms of the foot and the ankle, and hopes to create more adduction and internal rotation at the right hip, and also in this transformation zone to load up the foot and the ankle better. So we're going to go with a little rocker step, single leg toe touchdown, shifting back onto that left foot. Right foot comes off the ground. We're going to start anterior, meaning straight ahead, knee height, shin height, and then we have anterior lateral. Right foot still is driving straight ahead with our rocker step, and we're rotating and reaching out of sync. Arms with the right leg forward are driving to the right, which is out of sync, or to the same side. And then to further wind up in the transverse plane, create a little bit more of that relative adduction at that mid-tarsal joint, and inversion, a little bit more of that bite. Go out of sync at 90 degrees or 90 degrees, same side for the rotation. We have a TZ1 inverted foot position on the wedge mobilization strategy with a rocker step. We're going to go with a frontal plane out of sync driver to the same side. We're going to go with a rocker step, single leg toe touchdown pattern and progression. In the frontal plane, our common driver right here, bilateral upper extremity. Going with a rocker step as we shift forward into that right foot. Both arms are going to swing down out of sync or to the same side in our frontal plane. And then what that looks like in the transverse plane, we have a rocker step, arms are together, and we're going to rotate, pivot, and swing around. The arms are going to swing around the trunk and that right leg. And a little uncommon, we'll go with the chop. So contralateral. We're going opposite side with our chop from high to low. So as we use our rocker step, we get a mixture, a hybrid of the sagittal, frontal, and the transverse planes.